as you get out of the honeymoon period, which is like a year and a half after. So the first year after I had this surgery, I was never hungry. It was so easy to lose weight. But now my body has restabilized and found its level, and I can eat kind of what I want. I can't eat huge portions. I eat very small portions, but I have to eat more often because I get actually hungry. And especially when I was doing CrossFit 4 or 5 nights a week, you have to eat because you're like passing out, because you're using so many calories. And you don't realize the importance. My bariatric surgeon, who I adore, he's just such a great guy. His whole thing is calories in, calories out. That's it. Those 4 words. And if you talk to him, he'll say, you've gained some weight, he'll say calories in, calories out. And that's his basic thing. But then again, he has a whole office of nutritionists. I go to the nutritionist now twice a year, and we email all the time. That's a big part of it, the support system. They have pre-op and post-op support groups, and they meet monthly. And they send out emails saying, it's a pre-op group, and we need 3 post-op patients to come to it, in case there's questions. The pre-op patients have questions about how it went, or what, questions that you might not ask a clinician, but you might ask somebody on the street, like, oh, you had that surgery, what was it like? Did you get diarrhea, or did you throw up, or, what was it like? Like the questions that you would never ask the doctor. Instead you're in a setting, actually the woman who runs it is actually a patient who's been with them for years. She's a nun, and she lost like some ridiculous amount of weight, had to have her arms done because she had such curtains of meat.
Oh my God.
But her name is Karen, and she runs all the support groups. And it's like that. When I call, they know my name, and I don't think it's because they have caller ID. If I call up and I say it's Barb Galecki, oh, hi Barb, how's it going? You looked so great last time you see. And that whole personal attention. The chairs in the waiting room are the bigger chairs for the pre-op people. And then for the post-op people, they always have a smile and a comment. Oh, you look great. Doctor always wants before and after pictures to build their website. Yeah. He wanted me, my mother, and my sister because my sister had the surgery too.
Oh, she did?
The same one I did. Yeah, she lost about the same amount of weight. And my brother should have it too. You've seen him lately. He looks like Jabba the Hutt. But I think it's genetic, in addition. But he wanted the 3 of us to be like, together we lost over 375 pounds with their help. But we never did that. I don't, it just wasn't worth pursuing. But we're not those kind of people. But it's been the greatest thing I ever did for myself, because I discovered that I can make anything happen, right, Grace? I can make anything happen. I can make anything happen.
It's a daughter.
In addition to, having this tool, because that's what they teach us. It's a tool, and you can break your tool. You have to be careful. It's just like a tool, like a hammer or a saw, and you can mess it up. So you have to care for your tool, you have to use your tool, and you have to respect it. And I do, so I'm doing well. I just had a breast reduction because my boobs were so saggy, they were hurting my neck. And next year, probably a tummy tuck, because the doctor said that you could do CrossFit for the rest of your life every day, and that tummy's not changing. That's meat. That's sagging meat that has to come off.
From when you were larger.
Weight, so
wonderful.
Tummy tuck next, and then...
it's like all the scar tissue.
Then Jake Gyllenhaal, right?